you everyone for your interest in this webinar, for registering, joining our session, and spending the next 30 minutes with us as we kind of go through this really cool, innovative, exciting acceleration AI adoption in New Jersey healthcare, our collaborative and real-world impact solution that we've partnered with here. So welcome. Thank you for joining us. I'm Jennifer D'Angelo. I'm the Chief Operating Officer and Executive Vice President of the Healthcare Division here at NJII. My colleagues, I want to thank them for taking the time to join us today too. Before we get started, just a few housekeeping rules. Please mute your microphones. Please turn off webcams to minimize distractions. If you have any questions during the session, feel free to submit them using the Q&A. We will get to those at the end if we have time. Today's session is also being recorded and will be available for you next week that you can also share with your colleagues, and you also have a copy of the presentation. So great to be with you all. So we are getting to know NJII Healthcare and our new AI collaborative. We're really excited. We've been working with healthcare systems and vendors in this space for quite a while. We continue to advance our healthcare transformation through use case-driven AI and ML solutions delivered by our Healthcare Innovation Solutions team, which is HCIS. We focus our efforts there on value-based healthcare with MIPS and quality improvement reporting. I'm really excited to announce our partnership with Cognome, our AI collaborative partner here, really looking at AI and machine learning technology. They've got a very robust story with over 20 hospitals and offerings that empower healthcare leaders, clinicians, and operations teams to really unlock the full potential of AI and really revolutionizing how data is being used in the care delivery system for operational excellence. So this is kind of a teaser webinar. This is going to be a really high-level overview of some of the services that we're offering, our partnership, solutions, and use cases. So you'll keep following us. We have more to come after this. So joining me today, we have some presenters. Dr. Tom Villani, who works with NJII and leads our AI machine learning division at NJII, Vice President. Dr. Parsa Mirhaji, who is the Executive Director of the Center for Health and Data Innovations at Montefiore Health System, and the Chief Technology Officer at New York Clinical Data Research Network, and also James Green, who's the CEO of Cognome. So welcome and thank you to my guests for the prep and getting us to this point, but more so the partnership and the really neat things that we're doing in the healthcare space. So today's agenda, we're building an AI collaboration framework. We'll go into a little more detail of what that means and how partners come together in the health ecosystem to collaborate and look at solutioning and use cases, lessons from Montefiore Health's AI evolution, and what that journey looked like, essential components of a healthcare AI toolkit, high impact AI ML use cases driving real world results, and some ROI strategies for health systems. So before I really jump in, some of the philosophies around AI and machine learning is, does it replace people? There's that stigma of the fear factor. Will these solutions, really replace staff and resources? And so I've been at this for a long time. I talk about the EMR, EHR journey, and when hospitals and health systems are implementing those clinical technologies, there was always that stigma of, are we going to do more with less? Are we going to rely on systems instead of people for direct patient care? So a lot of that stigma has transitioned to AI. So I'm very excited to show the use cases that we have that really help support staff decision-making, clinical decision-making, and really prove to be such a significant return on investment for those strategies. So excited to take a deeper dive there. So building on the AI collaborative network, NJII has been fostering healthcare collaboration for over a decade in New Jersey. We've been a trusted partner to health systems and hospital provider practices throughout the state through a variety of different programs that we've partnered with Department of Health, Human Resources in supporting statewide interoperability and education around technology and solutioning within the healthcare systems. Our track record for innovation and healthcare transformation, we've had practice transformation, we have EMR adoption, population health, and we've been supporting providers in those decision-making tasks and also providing education and being on top of cutting-edge technology. Collaborating with AI within hospitals. New Jersey hospitals have a lot happening in this space, and there are solutions that are embedded within health records and systems that are being leveraged and utilized. We see a lot of vendors popping up in this space. So you'll soon see the partnership that we have with Cognome is different. There are a lot of players in the space that are developing cutting edge solutions that plug into electronic health records and other systems, not only to help with clinical information, but also to help with operational decisions within the organization. We'll also look at some of the benefits and return on investment for these efforts and collaborating with peers and what that looks like and the acceleration and adoption of AI modeling and optimization. So AI's impact on key healthcare use cases. So we thought this was a good visual to look at some of the active use cases that are in play. So continuity of care, clinical operations, clinical analytics, quality and safety, value-based care, and reimbursement. So we see the potential impact for AI in these specific use cases from medium to high, financial and non-financial impact and benefits. So optimizing point of care and referrals, improving continuity of care is incredibly critical. Also looking at the patient care journey, quality, safety, reducing major adverse events, and paying attention to the patient experience. Also what it means to be legally compliant and looking at the impacts to reimbursement with coding and denials management. Healthcare and an innovative collaborative. So if we look at some of the target areas for this research, we look at clinical research and data, alignment with healthcare domains, focus on high value use cases, peer-to-peer collaboration. There's tremendous value in collaborating with your partners and your peers. So part of this membership partnership is to look at those experiences and to tie the dots and connect the dots together. So looking at clinical data research and data management, AI optimization and training. Another significant component, operations revenue cycle management. So a lot of times when we talk about AI in healthcare, people's minds go to the clinical aspect, and there are some challenges and opportunities there with those challenges. But there's significant operational impact that you could have on revenue cycle management, contract reviews, reimbursement, rates across the board. And then another key component is patient safety, quality, and performance improvement and education. So we found that these three use cases are really just the start of the work that can be done with peer collaboration. And members of the collaborative would have access to not only these use cases, but also developing additional use cases that come out of that, and access to AI experts, data scientists, selected AI ML models, implementation and support tools to help you continue through that journey. So our featured model today is called AutoChart AI, and that's a prospective population health management utility. So the use case that we're currently using this within our organization is for the quality improvement program for New Jersey. So within HCIS, we help providers with their rosters and looking at their attributed patients and preparing those reports for the state for submission. So there's a lot of manual chart abstraction that goes along with that. So this tool, we're very excited to say, is a great supplement to that in streamlining, automating a lot of the manual process and giving us a larger ability to look throughout the electronic health record and really scale the results that are coming back. So it helps us predict attributions based on inclusion and exclusion criteria. It allows for prospective reporting and management of patients, which I think is critical. Having been previously a CIO at a health system, really, really important to look at prospective reporting. We can all look at retrospective reports, but to really change operational efficiencies and impact, perspective is really key. And that's something that you can keep looking at on an ongoing basis and changing operational procedures and behaviors before that look back period. It also significantly, as I mentioned, reduces manual chart abstraction, upwards of 90%, which is significant. So rather than having physical folks accessing those records, and if you have a blend of electronic versus hard copy, this is a great way to automate a lot of that and really expand the chart abstraction process to more than just maybe the narrow scope that you originally was by design, and automatically determine and apply CPT codes, which is really key to this program. So at this point, I'm going to turn it over to Dr. Mirhaji. If you can please walk us through some of the lessons learned from Montefiore's health system and your journey so far.
Yes, thank you very much. I'm Parsa Mirhaji. I direct the Center for Health Data Innovations. And historically at Montefiore, we started experimenting with AI beginning in 2014 in collaboration with Intel AI research labs. Just trying to learn how these things work and how they apply to enterprise use cases. But we soon realized that AI is not like your commodity technologies and tools, a high capital device that you buy and incorporate in your existing workflows. It actually interacts with your entire system. It changes the way clinicians make decisions. In their own practice, it transforms your patient-provider conversations. So you have to have narratives to explain both to clinicians and to the patients what is happening here and how these information and decisions are being made. It changes the workflows and clinical pathways inside your organization. And the care cycles transforms based on availability of some of these decision tools or automation engines that AI enables. Often it has unintended consequences. It creates disparities or can prevent from disparities if it is applied carefully that we need to be cognizant of. And then because of its overreaching influence almost everywhere in the health system, we realize that it will also require us to integrate that to our workflows like governance, like privacy and compliance. And it becomes really a part of the fabric of the entire institution. It is not a simple tool. And you will realize that over time, there's no corner of health system that will be unaffected or cannot be influenced by application of AI tools. So long story short, it is transformative based on where you apply it and how you apply it and the scale you apply it with. If you look into healthcare, you're going to see that AI is not the only transformative force that is happening. We also all are these days striving for becoming a learning health system, transforming healthcare to be more value-driven, patient-centered, and outcomes-oriented. So there are some other patterns of change and transformation are happening in healthcare. And AI is now influencing that too. And we have essentially decided at Montefiore that we are probably better off if we align our AI strategy with all of its transformative influences for our healthcare transformation strategy to become a learning health system. It is actually very interesting if you look into the definition of what a learning health system is and how learning health systems operate. You're going to see that AI, especially with the human in the loop kind of systems and the agent-based design and agentic architecture that are emerging these days, align very well with the conception of learning health systems. These two trends are essentially parallel. They both use and advocate for using all of your data assets, all of the multimodal data sets that are generated inside healthcare system, from structured EMR data, imaging, clinical notes, waveforms. All of that needs to be part of your data-driven analytic enterprise, whether or not you are using AI or you're trying to become a learning health system. They both are based on iterations of learning cycles. these iterative improvement based driven by outcome is essential for learning health system. It is the way AI works. So you can actually align these two systems. It is a collaboration between human and the learning machine or the learner. It strives to get better by human feedback, by stakeholder engagements in a multidisciplinary fashion. And that is also something that you can leverage in building the best AI and the best learning health system and so forth. And then both of them are really fraught with ethical and legal and the compliance issues and considerations from human subject protection to privacy preserving approaches for use of data and application of analytics in large scale. So the lessons that we learned at Montefiore are that there are two waves of transformation happening. And we want to adopt these data-driven approaches, whether or not by AI or for learning health system. Maybe we should combine our forces. Maybe we should bring all of these stakeholders together to think about it as a unified force of transformation. And remembering that we will probably not have time to do it twice. We should really think carefully, integrate these approaches in a way that as we adopt these technologies and as we apply and learn from the applications of these technologies, we also transform the way we think, we do things at healthcare. We take care of patients, we optimize efficiency, we learn through this process, and we innovate. So that's essentially our strategy at Montefiore, to bring these two forces together and apply them uniformly. And the question becomes, I'm going to just end with this, what is the data architecture for it? How do you actually do this, given the kind of data and the kind of infrastructure that we have in healthcare today? How you integrate that to your existing systems, to EHR? How do you guarantee trustworthiness and responsibility that it puts on our shoulders in a accountable way? And that's what probably Cognome's contribution is to this field, having an architectural understanding of how it applies to a learning tech system.
Thank you so much for that. I like that you continue to highlight we do what we do to impact direct patient care and patient outcomes, right? So sometimes when we get in these very technical discussions about tools, electronic health records, AI solutions, how they plug in and play. I mean, the ultimate goal, keeping our path focused on how are we helping patients and changing outcomes.
Exactly.
And how are we providing providers and clinicians the tools that they need faster, reliable, and do more with less. So I love that you brought that to light, because oftentimes, like I said, we get very technical, overly technical, and look about, the integrations with systems and solutioning, but really keeping that at the forefront. So thank you for that explanation. Now I'm going to turn it over to James Green, CEO of Cognome, for him to walk through some of the strategic priorities for their AI adoption and solutioning.
Yeah, thanks for the intro. So Cognome was founded actually to help Dr. Parsa Mirhaji accelerate AI adoption inside the Montefiore health system. And so to a large extent, we are insiders. And I wanted to sort of share some of the experiences that we've had inside health systems, first on the strategic priority side and then on the ML ops side. First and most importantly is this top left box aligning with critical operation, research, and business priorities. This, everyone and their uncle wants to do AI, and it's really easy for you to just let 1,000 flowers bloom. But it's not a good idea. Once that happens, you lose control of these things, and immediately you have trouble on the next two issues, one of which is a unified approach for AI with governance and adoption. So if everyone is building what they think they need, then you're going to have a very, very, very hard time making sure that you have tools in place to manage the governance around all of those things. Also, demonstrating ROI. So, people perhaps don't always understand all of the costs associated with some of the things that they're doing, and that can range from people costs to GPU costs. But it is very important that you have this clear vision of where you want to go, that you use that as a filter to only focus on the initiatives that are important, that you have governance around those things, and then finally that you develop the talent you need around them, and that you have a real core strategy around talent. Too often we've seen institutions said, well, I don't have budget for a large person, so I'm going to hire a more junior person. They train them up, and as soon as they're trained up, they go for a bigger job somewhere else. So having a real sort of AI nurturing and retention plan around that, so that you have some longevity and everyone understands the tool set, we also see as critically important. As we move on to the ML ops thing, and perhaps we could just, yes, there you go. These are the four initiatives on the sort of more technical side that we think are super important. And really the first one and the fourth one are the most important. This first one, is your model running locally or remotely? We believe really fiercely that all the models must run locally. If you allow a model to be running remotely, you have privacy issues, you have security issues, you have data leakage issues. It's very, very important, we think, that your models should run locally. And that leads immediately into the next question, which is, have you got the right infrastructure to manage your models? We have experienced both on-prem and on cloud, meaning your cloud, infrastructure to manage these models. It is much easier to do on the cloud. You can turn on and off resources very, very quickly, but it can totally be done on-prem as well. And you are going to want to make sure that those governance tools and things that we talked about on the first slide are going to need to be built into this infrastructure that you use to manage your models. And then next off, have your models been trained on your own data? It is incredibly unlikely that a model will work in your institution if it hasn't been trained on your data. And some of the reasons for that are not obvious. So if you have an example that I heard that I thought illustrates this super well is two institutions, one which has an ambient dictation and one in which people put progress notes in at the end of the day. If your model is looking at progress notes, it's going to get them much earlier in institution A than it is in institution B, and that will affect how the model performs. So just how you gather your data can affect how your models perform. So they need to be trained on your data, not only because your data is likely to be different, but the way that you gather your data is likely to be different, and that will affect the performance of your model. And then finally, again, I think this sort of first one is your model running locally. Yes, it should be. And the last one is the black box. This is also critically important. I don't need to tell anyone who's listening here that there is a lot of distrust in the clinical community around AI. And one of the reasons for that is that it's very difficult for a clinician to have a discussion with an AI model. And we think that should be enabled. Now, I don't mean that when I say it should be enabled, they literally should be talking to an AI. I mean that when a model says, I think this person has sepsis or whatever it is predicting, that the reasons that it's making those should become transparent to the clinician. So the clinician can say, I don't think so. And then then the clinician can look at why that decision has been made, look at all of the variables in it, and then come to a conclusion about whether it's right or wrong. Maybe the clinician knows something about the patient. The patient might have another disease or infection that is making those numbers look the way it is. They do, and the model may not know that. And so if the clinician cannot see why the model is making the decision, you're going to have rampant distrust in your organization. So it's really, really important that the model is built into the clinical workflow in a way that is transparent. And I'm going to hand it over to Tom, who I think is going to talk about some more specifics.
Yeah, thanks, James. I'm Tom Villani, the VP of AI and Machine Learning for NJII. Today's healthcare providers face an array of challenges, from staffing shortages, burnout, the need for improved patient outcomes while containing costs. AI solutions aren't just optional anymore, but essential tools for health systems that are seeking to transform care and delivery. At NJII, we've developed an ecosystem of proven AI solutions in partnership with Cognome that address a lot of these real challenges. Our framework includes 4 essential components. First, our AI governance platform, Explainer AI, which I'll talk a lot more about on following slides. This ensures that your AI deployments are transparent, explainable, and compliant. Second, our operational models tackle resource-intensive challenges like chart abstraction, predicting case cancellation and length of stay, and which solve concrete workflow issues. Third, our clinical models support quality improvement, patient safety, and value-based care initiatives with data-driven insights. And finally, our custom AI development services allow us to address unique problems with customized solutions for health systems. What sets our approach apart is that these aren't theoretical applications, they're field-tested solutions that deliver measurable value to leading health systems across the region. On the next slide, I'll talk a little bit about how we ensure responsible and secure AI in the healthcare setting. Oh, there it is. And so implementing AI in healthcare comes with really important responsibilities, since patient lives and confidential data are all around. The risks of biased algorithms or security breaches really can't be overstated. Our approach to responsible AI is the only one on the market that's been built on the 2 leading frameworks for AI, NIH's AI Governance Framework and the NIST AI Cybersecurity Framework. Our AI governance platform is based on 5 key aspects. Firstly, our governance program establishes clear accountability and oversight processes. Secondly, we prioritize building trust with clinicians and patients through transparency and explainability. And third, we implement robust safeguards against cybersecurity threats to ensure compliance with all the relevant regulations, including HIPAA and emerging AI guidelines. Most importantly, the continuous monitoring system vigilantly watches for hallucinations where AI generates plausible but actually incorrect information, as well as for bias, discrimination, and data drift that would affect the model performance. And finally, comprehensive auditability and lineage tracking document every decision point. The framework's not just about risk mitigation, it's about creating the trust necessary so that AI can actually fulfill its potential. Without safeguards like this, even the most powerful AI tools will rightfully face resistance from providers and from patients too. Can you go to the next slide, please? So, as James mentioned before, healthcare AI adoption faces a really crucial challenge, the black box problem. Clinicians, administrators, I mean, anyone is right to hesitate to trust an algorithm that they don't understand. Compliance officers worry about regulatory and ethical risks. We have a tool, Explainer AI, that directly addresses these concerns, which is the first governance platform that's been purpose-built for healthcare AI applications. Unlike general AI governance tools, this is specifically for healthcare's unique needs. It essentially provides a breakdown of model configurations and performance metrics over time, breaking down the results by patient populations so you can identify disparities and ensure the predictions stay valid and correct over time. The platform is built on the established frameworks from NIH and NIST, ensuring alignment with evolving healthcare AI regulations. What makes this transformative is how it fosters trust. As you can see here, clinicians can really inspect and take a detailed look at why the model made the decisions that it made and see how it's performed over time, allowing them to exercise their clinical judgment appropriately and have a good understanding of why the model is making the predictions that it is. At the same time, administrators and compliance teams gain the documentation and auditability that you need for governance, for regulatory oversight. And this kind of transparency is critical for deploying AI in a responsible manner in clinical settings, since patient safety is paramount. So you could go to the next slide, please. The real measure of AI in a healthcare setting isn't theoretical performance, it's real-world impact. And so what we have to look at is, does a model actually have an effect that you can measure that improves the value of healthcare in some way? Our models have shown consistent value in healthcare settings. And here's a couple of examples on this page here. The sepsis model, our sepsis management solution, demonstrates exceptional accuracy with the lowest false positive rate in the industry. This is just 2% compared to 7 to 27% from competitors. This is really important for clinicians since if you have a lot of false positives from systems that are crying wolf all the time, clinicians experience alert fatigue, and they tend to just ignore that. And at worst case, it creates a lot of wasted time and effort trying to prove that the system is just creating a false positive. As you can see from the middle chart, this is a really cool model where we essentially are able to predict the likelihood of case cancellation. And as you can see right here from the data, after implementing this model, there was a significant decrease in the actual case cancellations measured. And this resulted in over $500,000 revenue gain within just 6 months at one institution by identifying patients who are essentially at risk of missing procedures and enabling proactive intervention. When expanded to an outpatient setting, this saved facilities over $1 million a year by reducing no-shows. And as Jen mentioned earlier, the AutoChart AI solution eliminates over 90% of the manual chart abstraction hours while requiring minimal validation, which saves about $1 million annually and improves data quality for these submissions. These models aren't just incremental improvements, they're transformative capabilities that directly impact both patient care and financial sustainability, delivering real ROI to justify the continued investment in healthcare AI. And now I will turn it back.
Thanks, Tom. Thanks everyone for the information and kind of walking through the journey of the solution and some of these really critical use cases. So sepsis gets a lot of attention for obvious reasons. So I really love that we highlighted that use case here. I know that resonates with anyone that's in a hospital setting on how to have early detection of that, and looking at the false positive rate, making sure that you understand what that means and what that looks like. So there are a lot of solutions in the market for sepsis detection and prevention. So knowing what you're looking for, knowing how to vet those vendors, and really looking at the outcome metrics for that is really critical when making these decisions of what solutions you'll bring into your environment. Again, looking at case cancellation, I can't emphasize that enough. Being on, having worked in a provider practice and hospital system, that case cancellation prevention is critical. We would do retrospective reporting on how many cancellations, no-shows, but to get that prospective look at an insight to possibly change that and impact your bottom line is really critical. So I love that we've highlighted some really substantial use cases. These are just the 3 that we're working on now, but there are many others that we'd love to partner and highlight with. So we're going to look a little bit more here on some other ways that we can continue to collaborate through this collaborative and working with your hospitals and health systems and provider practices. So this kind of wraps all of this back together, for us with the AI collaborative, again, working with your peers, aligning on use cases to gain access to experts and models to continue to improve your business line and look at your care outcomes and options. The Explainer AI, again, leveraging the only AI governance platform built for healthcare, which I think is very important. There are many tools available in the marketplace, but really being educated on what tools are appropriate for your environment are essential as you're making that decision and making that decision confirmed. Looking at AI ML modeling, using our growing marketplace of different models, and again, coming together as another benefit of the collaborative, optimizing or building services based on those modeling and platforms, and hosting and training. So your AI solution can be hosted and enhanced by NJII, and we'd love we could talk through more of what that partnership looks like and how do we really train your staff. A lot of these tools are really based on staff adoption and staff understanding and being educated on what the tools can provide to their workflow, provide to your practice, and then ultimately how to support those solutions to just change patient outcomes and metrics and how to be able to leverage that. So we hope that you got a lot out of our teaser session today. We do have a lot of additional use cases that we could go through with you. So Please contact us if you want more information. All of us are available. Our HCIS folks have been, actively using this solution for chart abstraction and helping with quality improvement programs for New Jersey, which we're in that time period now. For those of you who have joined that are part of a hospital system, I know you're feverishly working on that. So we're here to help if you need some assistance and support in that area. The perspective reporting really is an essential tool to be able to pull additional information out of the system that would normally take you so much longer in manual time and effort around that. I think we have a little bit of time for some questions and answers. Let's see. First question was, is there a fee to join the collaboratives? Yes, there is, and it really depends on facility, provider, health system type, but we could certainly walk you through that when we can connect separately and talk about that. Question for Parsa. So what do you see as the greatest challenge for healthcare systems in their adoption of AI?
Well, there isn't one. There are many.
Right.
Challenges, but I would highlight the problem of, I would say, literacy and talent management from both technical implementation and adoption perspective, as well as governance perspective. One thing that we have realized at Montefiore is that AI governance is not a job of a few people. There isn't an office of AI governance that you should run. AI governance is the responsibility of all members of the institution, and raising the awareness, the literacy, the understanding of how AI works and what it does best and where it fails and how to identify those failures, when to trust and when to ask questions and what are the right kinds of questions to ask. Are things that I think collectively we all need to learn about and understand that. And then promotion of that institutionally is the challenge that will require investment and strategic thinking. And of course, there are technical challenges, infrastructure challenges, integration challenges. Privacy is an issue, just understanding the implications of adoption of some of these technologies from privacy perspective is a big challenge. We were talking about data leak or data exposure. You may want to also consider the fact that AI will leak information, even if you don't share direct identifier and PHI from it with it. It will leak IP. And understanding those leakages will be essential. I assume, I think that was part of the reason why James was reflecting on running AI models internally and not send your data to a third party.
Exactly.
Because of all of these privacy and IP leakage issues and so forth. So there are ethical issues. Almost every aspect of the healthcare where you adopt AI will have its challenges that we need to be cognizant of. But organizationally, I would rank the literacy culture as the biggest thing that we need to address as we are addressing the technical implications of adoption of AI.
Absolutely. I mean, I think that falls along the same lines as introducing new technologies and operational efficiencies into any one of your systems. AI is no different. It's not just an IT implementation or an IT problem to solve, but it's a collaborative rollout that needs to happen multidisciplinary, and making sure that your team is on board. There's a clear understanding of the use of the tools that are available, proper use, and making sure that that's the education component is rolled out at the same time to increase adoption. And also, helping your C-suite team understand the importance of these tools, and really educating them as well. So it's not just the day-to-day staff, but it's really making sure the leadership team is on board and supporting that. So great question. Next question. This one is for Tom. Do you have a framework for a best practices governance model that you can share?
Oh, yeah. So, NIH and NIST have these governance frameworks, essentially, which for responsible AI and governments, that's becoming the standard across the industry. We've essentially combined these models to create a model that aligns with the clinical, operational, compliance, security. And so this is probably something that we could put together and share, but just to give you a little bit more detail about that.
Perfect. Thanks, Tom. We have just a few minutes left. We have one last question. I appreciate everyone hanging in there with us and joining us today for this webinar. So this one's for James. How have you validated your models?
Yeah, that's interesting. So we only build our models with frontline clinicians or administrators who are in the use case. So all of our models have been validated by the institution that we built them with. So a lot of them were in the Montefiore health system. So that's a very big and large and diverse data set, but it does depend on the model. And then we like to go ahead, and if we've built one for one system and then we're going to roll it out in another system, we like to retrain that model on that system. So they're trained wherever they were built, and then they're retrained wherever they're rolled out. And we also have something we call federated learning. So once the models are running, if the same model is running in a couple of institutions, those institutions have an opportunity to collaborate and share the output of the model with one another. And if they do, then the models can learn from those diverse data sets. So one population, I'll be crude about it, one population might have an older group of people and another might have a younger, or it might be a different race or gender mix or economic mix. And you might find learnings that the model will have that will change depending on where the provider location is. So interesting question.
Great, thank you. Well, we're almost at our time, so I just want to thank everyone for joining. Thank you for submitting your questions. If you have additional questions or you want to get in touch with us to look at some of the modeling that we're currently using with several facilities in the state, please reach out to us. Our contact information is there. Again, thank you for joining us this afternoon. Thank you to my presenters for just taking us through that journey and really explaining some of the solutions and best use cases that we currently have available. So great. Have a wonderful day, everyone, and thank you for joining us, and be on the lookout for additional webinars with some more news and information on the AI initiatives that we continue to develop and roll out here at NJII. Have a great day, everyone. Thank you.